Remember the cardinal rule of applying to residency? You never ever speak about the money and you never ever speak about the call, right? Well, that's different now. If you're a graduated fellow or a resident, listen up. I'm sure you've done your due diligence about your new place of employment or the job or a group setting that you're looking for. You know all about the call that you're going to do, you know all about the patients you're going to be treating, you've talked to your new colleagues, you've decided that this is a great place for you and your family, and you're ready to make the move. However, did you ask one of the most important questions? Exactly how and why you're going to get paid. You see, the process of getting a job after residency or fellowship is the exact opposite of how it was when you got into medicine in the first place. Remember the interviews, the match, the questions you were asked. You felt like you were lucky to even be there in the first place, and you felt like you were lucky for them to choose you, right? Well, now it's the complete reverse. It doesn't matter what kind of doctor you are, what kind of specialty you are in. There's a nationwide shortage of physicians, and no matter where you interview, they are the ones who are lucky to have you, and they need you more than you need them. So it's very important to understand it, and that's why it's okay to ask a question about your finances. Remember the cardinal rule of applying to residency? You never ever speak about the money, and you never ever speak about the call, right? Well, that's different now. You have to ask. We also have what I'd like to call 4 cardinal rules of asking your new prospective employer before you sign your first contract. Number 1, ask where your patients are coming from and make sure that there's enough patients for you to see. Because if you don't have any patients, you don't have any business. This is not going to be a problem for most large groups that you're signing with, but it's still a very good question to ask. Rule number 2, you need to know how you're getting paid. In other words, you need to know where's the money coming from as far as the source of it. Is it coming straight from patient interaction? Is it coming from ancillary services? And if so, you should find out how those ancillary services are being reimbursed straight to you. Does your group have any debt? And if it does have any debt, are you liable for it now if you're going to be parking, for instance? And finally, is your group being subsidized by federal or local government? And if so, how those funds are being passed on to you? Rule number 3, you have to ask about your professional PPO and HMO contract. Why? Well, first of all, it's a good idea for you to know just how much you're getting paid. But more important than that, your patients will ask you. They will ask you how much services cost. And if you don't know, you will look stupid. And it's okay to ask that from your group. And rule number 4, which again might seem a little silly, but you have to ensure that all providers, all healthcare providers with the same credentials are getting paid equally. Equal pay for equal work. You'll be surprised how much of it is not actually happening. The rules 1 through 4 that we talked about, they're not set in stone. There's more and there's could be less, but one thing remains constant. If you ask any of those questions of your new employer, and if they hesitate, or if they tell you that they don't know, or if they tell you that you don't need to know, it's time to move on to the next group. We hope you enjoyed the video. Reimbursement RX was founded to educate residents and practicing physicians on how to navigate the business of medicine from the doctor's side. To stay up to date with our latest insights, please like Reimbursement RX on Facebook, subscribe to Reimbursement RX on YouTube, and check us out online at reimbursementrx.org. Thank you for watching.